Welcome to The Explainer. Today, we're diving into something you probably never ever think about when you walk into a hospital, but your health absolutely depends on it. I'm talking about this simple hospital bed sheet. It turns out managing this seemingly mundane, everyday object actually requires some seriously cutting-edge technology to keep patients safe and to keep these vast medical facilities running smoothly. Okay, let's just dive right in. 500,000. That is the staggering number of bed sheets lost every single year in the healthcare networks we're analyzing today. 500,000 sheets, basically vanishing into thin air, and it is almost entirely due to poor trucking. Now you might be wondering, how on earth does that even happen? Well, honestly, the reality of manual linen management is pretty much pure chaos. When hospitals rely on physical counting and paper logs right in the middle of incredibly busy wards, severe inefficiencies just happen. Sheets get mixed up, they get lost in transit, or someone accidentally throws them away. It leads to this really dangerous lack of accountability. Because of this old school way of doing things, hospitals are literally losing between 10 and 20% of their linens annually. When you do things manually, human error is just unavoidable. And look, this isn't just a logistical headache. It's a massive financial drain. We're talking a 300,000 OMR loss for sheets alone. But actually, there is something way worse than bleeding money. Untracked linens open the door to a terrifyingly high risk of infection and cross-contamination. But here's the good news. There is a total game changer of a solution out there called Smart Linen. Basically, it's a digital platform that uses RFID and QR technology to track hospital garments in real time. And I cannot stress this enough. This isn't just about saving a few bucks on cotton. This is a vital, frontline medical safety tool that is fundamentally transforming hospital hygiene. Imagine totally replacing all that manual guesswork with real-time digital tracking. Instead of nurses or administrators wondering where the clean sheets are or stressing about whether a contaminated batch was actually processed properly, they have complete, instant visibility. They can see exactly what's clean versus what's in use right at their fingertips. So, how does this whole ecosystem actually work? Well, I want you to personify a single bed sheet for a second. Imagine you are that sheet, and we're going to follow your journey through the 8 stages of the Smart Linen system. Let's walk through the first half of this cycle. First, the linen is used in the department. You leave the clean storage and go straight to a patient's room. Fast forward to hour 6, and it is collected by housekeeping into a designated trolley. But here is the really clever part. At hour 7, it is scanned using RFID or QR technology. That instantly registers its exact status. After that, by hour 8, it is sent off to be washed and deeply disinfected in high-temperature industrial washers. Then, moving into the second phase of the day. Next, around hour 10, the linen goes through a strict quality check to ensure total cleanliness and safety. They're making sure there are no tears, no stains, nothing. Then it is folded, packed, securely stored in a clean environment, and finally redistributed back to the department for reuse. And the absolutely crucial takeaway here? At every single stage of this process, the linen is tracked digitally in real time. Now, I want to pause our story right here to ask a really critical question. We know it makes things run smoother, but why does real-time tracking matter so incredibly much for infection control? Preventing the spread of hospital-acquired infections is quite literally life or death. So how does knowing where a sheet is actually help with that? Well, the contrast is just stark. With untracked manual linen, you have a dangerously high risk of accidentally mixing clean and contaminated items. Plus, manual counting actually exposes the staff themselves to pathogens. But smart-tracked linen, it digitally separates the clean from the dirty. It absolutely verifies that the high-temperature wash actually happened. So the crucial point is that by knowing exactly where a contaminated sheet has been, you break the chain of infection before an outbreak can even start. Proper RFID tracking is, no joke, a frontline defense against disease spread because it ensures the exact proper handling of clean versus contaminated linens at every single touchpoint. The hospital is drastically reducing infection risks for literally every patient and staff member in the building. It's a massive safety net. All right, let's shift gears for a second to the macro business perspective. Because at the end of the day, a safer hospital also has to be financially sustainable, right? Based on a pretty conservative estimate of just a 40% reduction in linen loss, the revenue saved is amazing. It grows from 18,000 OMR in 2027 all the way up to 60,000 by 2029. And even when you factor in the operating expenses, which hover between 8,000 and 16,000, the net profit climbs steadily. Every sheet saved goes directly to the bottom line. Which brings us to this absolutely massive number, 275%. By 2029, this system generates a 275% return on investment. Honestly, that is just an astonishing figure in the world of healthcare operations. And the craziest part? It is achieved simply by keeping track of inventory through intelligent design. No magic, just smart tracking. And it gets better. The system breaks even by month 7. Yeah, you heard that right. The setup runs at a slight loss for the first 6 months while you're rolling it out, but from month 7 onwards, it is profitable. Hitting that break-even point within the very first year makes this an undeniable, absolute no-brainer upgrade for hospital administrators and investors.
So we've walked through the digital journey, the vital health benefits, and the rock-solid economics. I want to leave you with one final provocative thought to chew on. In an era of highly advanced medicine, where we literally have robotic surgeries and AI diagnosing diseases, can we really afford to leave basic infection control and massive financial loss to manual counting? It is so often these hidden foundational technologies, like putting a microchip in a simple bedsheet, that truly empower our healthcare systems to stay safe. Thanks so much for joining me on this explainer, and remember to always keep questioning how the everyday world around us actually works.